Hello everyone, my name is Christopher Flood. I am a senior at the University of Arkansas at Little Rock, where I'm currently working towards my degrees in biology and psychology. Today I'll be discussing Leonurus cardiaca, most commonly known as motherwort of the Lamiaceae family or the mint family. As a brief overview, I will discuss the botanical description of motherwort, including some of the characteristics that are useful in identifying it among other plant species. We will go over some of the traditional uses, as well as motherwort's utilities in treatments of the cardiovascular, nervous, and feminine nature. We will discuss the chemical composition as well as biological activities, as well as cite a clinical study that used an oil extract from motherwort in the treatment of patients that suffer from arterial hypertension. Motherwort is contraindicated in some situations and also has some relevant drug interactions that should be discussed. And then we'll go over some of the current uses in CAM therapies. Motherwort is native to Europe, but is now naturalized in regions of Asia as well as North America. It is a highly aromatic perennial herb with a bitter taste. One of the main characteristics of motherwort are the purple to white fuzzy flowers that form at each leaf node. Motherwort has an opposite leaf configuration that support the dark green serrated palmate leaves. It can grow to a height of 3 to 5 feet and is found in a variety of locations, including along roadsides, in forest or pastures, and is also cultivated in many gardens around the United States and in Europe. It is of ecological importance in that it serves as a source of nectar for various species of bees, as well as a habitat or refuge for field sparrows. The scientific and common names provide a lot of insight in how Leonurus cardiaca has been used throughout history. Cardiaca, referring to the Greek word for the heart, shows its affinity for the heart and the cardiovascular system. It has been historically used in treatments of heart palpitations and high blood pressure, but it has also been taken to strengthen the heart and strengthen the function of the heart. It is notably documented in treatments of women's health. The Greeks used it thousands of years ago to relieve pain and tension during childbirth. It is also used as a uterine stimulant for cases of delayed or irregular menstruation. It has been used as a calmative or a sedative for complaints of the nervous system, such as anxiety and sleeping disorders. And what's interesting about the cardiovascular system and the feminine complaints is that generally these complaints stem from nervous origins, such as heart palpitations are generally associated with fear or anxiety. Motherwort contains many chemical compounds, including alkaloids, tannins, flavonoids, terpenes, volatile oils, among others. Now, although the alkaloids consist of less than 1% of the entire chemical composition of motherwort, it is thought to be one of the most important. Stachyndrin is believed to function as the main component in uterine stimulation. Betonacin has been noted as providing some of the anti-inflammatory effects that we'll discuss later. Leonurine functions as a uterine stimulant and a smooth muscle relaxant. Flavonoids such as ginkgonin and rutin are believed to possess anti-inflammatory, antioxidant, antimicrobial, and antiviral properties. An important terpenoid of motherwort is ursolic acid. As we will discuss later, ursolic acid is a triterpene that has shown great potential in reducing the respiratory burst activity, which is associated with inflammation. Again, ursolic acid is a triterpene from motherwort, and it was examined for its anti-inflammatory properties by testing its ability to inhibit the respiratory burst activity. Results showed that ursolic acid, denoted as compound 1 on the chart in the upper right, inhibited the respiratory burst activity. It's interesting that it was more active in inhibition of the respiratory burst activity than common anti-inflammatory drugs such as indomethacin and aspirin. In another study, lavandulifolioside was tested for its pharmacological properties, and the results of this study showed that it decreased blood pressure and the heart rate. More specifically, it prolonged a PQ, QT, and QRS complex. The PQ, QT, and QRS complex are seen on the ECG, which really depicts the length of the heartbeat. Motherwort has also shown potential as an iron chelator. Excess iron in the circulatory system contributes to complications such as heart failure, diabetes, and liver failure. In this study, the aerial parts of motherwort were found to be very efficient in iron chelating. They determined that this was due to the phenolic and flavonoid content, and that these constituents interfered with the formation of the varus-ferrosine complex. In an additional study to discover some of the mechanisms of action in the species of the Lamiaceae family, the phenolic compounds of Leonurus cardiaca showed considerable potential as antioxidants. In a clinical study on the pharmacological effects of motherwort, patients suffering from stages 1 and 2 of arterial hypertension with accompanying nervous disorders were studied to show the effects of an oil extract called Leonurus oil extract. 50 patients ranging from ages 18 to 75 were given 2 300 milligram gel capsules twice daily. At the conclusion of the trial, the systolic and diastolic blood pressures dropped dramatically from baseline numbers. Patients showed similar improvements in heart rate and other parameters such as anxiety, mood, and activity. As with most plant species, motherwort should not be taken if there is known to be allergic reactions involved. Hypersensitivity in motherwort usually results in dermatitis and skin rashes. It should not be used if pregnant or nursing, as it is a uterine stimulant and it initiates uterine contractions and can induce labor. There are some relevant drug interactions, including heparin and warfarin, which are anticoagulants. The anticoagulants affect the blood clotting factors, and when used with motherwort can cause a decrease in blood clotting factors and can be difficult to stop bleeding and cause increased bleeding. Cardiac glycosides such as digoxin and other beta blockers could cause bradycardia or decreased heart rate when used concurrently with motherwort. Herbs like foxglove also contain cardiac glycosides and should also be avoided when taking motherwort. Many of the current uses in CAM therapies of motherwort really mirror that of the traditional uses. Today it is used as a supplement in treatments of heart disease, for treating high blood pressure. It is used as an antioxidant. It is used as a sedative or a calmative for people suffering from anxiety or in women who are tense due to premenstrual syndrome. It is still used today in treatment of delayed menstrual cycles or irregular menstrual cycles. It is generally taken as a tea, but can also be taken via capsule or a tincture or in alcohol. In conclusion, motherwort has a very extensive history as a medicinal plant. It has been used for thousands of years, dating back to the Greeks. Some of the active compounds have shown efficacy as an antioxidant, an anti-inflammatory agent, as well as reducing complaints of anxiety. Um, a lot of people use it as a supplement to their normal blood pressure medications, and it is highly underrepresented in research. And until the active constituents of motherwort can be identified, future research cannot really move forward and solidify its position as a medicinal plant of the future.